Assalamu alaikum and very good morning to all of you. Thank you very much for joining us today. The topic of today's discussion is graphic health warning, combustible, smokeless, and new novel products. Just to give the background of today's discussion, the graphic health warning has been one of the most significant issues in the recent times and in tobacco control efforts of Pakistan. So during 2015, the size of the graphic health warning was proposed to be increased from 40 to 85%, and the picture was also rotated after almost 5 years of the continuity. FCTC, which is Framework Convention on Tobacco Control, desires that the graphic health warning must be kept at 50% or more, but not less than 30% of the cigarette pack, and needs to be rotated frequently. Rapid ingress of new novel products in Pakistan has brought new challenges for the country. Absence of pictorial and textual health warning on these products is not unique to Pakistan, as these products and the tobacco industry continue to defy the tobacco regulations across the globe. The smokeless tobacco products such as Meswar and novel products such as Velo, Zine, Left, Drift, On, etc., are only adding to the enormity of the issue, necessitating immediate policy and regulatory attention. So, in today's webinar, we'll dilate upon the following aspects. Number one is the update on 85% increase, court case impending decision in Islamabad High Court. Number two is the delay in implementation of the rotation in Pakistan, which is overdue by many years. Number three is best practices in graphic health warning on smokeless and new novel products from around the globe. And number four is policy recommendations on the issue of graphic health warning, especially on the new novel products. For this, we have a very august panel. We have with us Dr. Minhaj Siraj. Dr. Minhaj is working as a professor with Health Services Academy. He remained Deputy Director General for Tobacco Control Cell of the Ministry of National Health Services Regulation and Coordination, Government of Pakistan. And he recently retired as Joint Executive Director of Pakistan Institute of Medical Sciences, PIMS. Dr. Minhaj has also done MSc in Public Health, and earlier he did his MBBS from Ayub Medical College, Ahmedabad. We have the honor of her presence, Dr. Sahana Hagde. She's a professor and head of the Department of Public Health Dentistry at D.Y. Patel Dental College and Hospital, Pune, India. She completed her studies from ABSM Institute of Dental Sciences, Mangalore, and KL Institute of Dental Sciences, Belgium. She has 25 years of teaching experience. On the research front, she has enormous publications to her credit, with nearly 20 research projects on tobacco-related ophthalmology, e-cigarettes, Empower for tobacco control. She has been awarded the IGTC scholarship from 2021 to 2022 for admission to Global Tobacco Control Certificate, Johns Hopkins Bloomberg School of Public Health, Baltimore. She's presently pursuing her PhD on tobacco-free schools. We have with us Mr. Wasim Iftikhar Janjua, who's a PhD scholar at NUST. Besides his numerous publications on peace and stability, he's among the few scholars working on critical discourse analysis across the globe. He also has earned a gold medal from National Defense University, and he loves to teach and has been associated with more than 4 educational national institutions, including NUST and Beria University, Islamabad. We have this Dr. Samra Mazhar, and she is the Deputy Director Programs 2, Non-Communicable Disease and Tobacco Control. She is the focal point of the World Health Organization, FCTC, and illicit trade at the Ministry of National Health Services, Regulations and Coordination at Government of Pakistan. We have with us Colonel Azhar Salim. Colonel Azhar is the former Chief Executive Officer of Human Development Foundation. He has made a lot of efforts for tobacco control and has taken a keen interest on the subject also. Last but not the least, we have Dr. Larissa. Dr. Larissa graduated from the University of Jordan School of Dentistry in 1993. She is a tobacco dependency treatment specialist, co-founder, and the Secretary General of Tobacco Free Jordan, an NGO that works on promoting public health law. She's working at a grassroots movement with children to educate them on the harms of smoking and exposure to secondhand smoke. It is said to be the largest Arabic content Facebook page on tobacco control, and their Twitter handle is at Tobacco Free Jordan. Dr. Larissa is part of many national committees on tobacco control. Her NGO is the recipient of WHO 2020 World No Tobacco Day Award. With this brief introduction, I would request Mr. Wasim Iftikhar Janjua to please give an agenda-setting presentation to set the theme of today's discussion. Over to you, Mr. Wasim. I think there is some connectivity issue with Wasim Janjua Saab. Wasim Saab, can you hear us? Wasim Saab, can you hear me?
Yes, sir. Sorry, I just got disconnected and connected again. Let me share my slides with you, please.
Sure. The floor is yours now.
Okay, thank you so much, Wasif, for this kind introduction, and thank you for arranging this webinar. We at STPI have been working on graphic health warning for the past few years, and some other policy matters which need our attention related to graphic health warning, as well as policy itself are under consideration, and we are working on that as well. So in next about 5 minutes, I'll be talking about the graphic health warning in Pakistan and putting forward some recommendations. Okay, so the increase in size was, as Wasif has already indicated, that was proposed during 2015, but there was a big backlash from the tobacco industry, and we had to reduce it. We had to go back to 40%. Then there was a kind of compromise struck between the ministries and the tobacco industry, and we came up with 50% graphic health warning during 2018, and which was raised to 60%, which is the current status of the health warning. As per the SROs or regulatory orders, the picture or warning is supposed to be placed on the top, front, and back, and must contain the warnings, textual warning, both in English as well as Urdu. The last warning, the last rotation that was done for the picture was during 2015. But when we rotated, when we changed this 40% to 60%, we also came up with new pictures. And the one which you see here on my screen, that is the foot gangrene that has been on the packs since 2018. So this story is already clear to you. I mean, this case is pending in front of the court, and all of us are hoping that the case will come out favorable in the favor of the tobacco control advocates and the tobacco warning, graphic health warning that can be increased to 85%. As already indicated, that the warning needs to be rotated generally every year or as decided by the government. The ministry issued only one graphic health warning, which I already showed you, and that has been on the packs. The next warning was supposed to be rotated during probably last November or December, but it's been almost 10 months that nothing has happened, and new health warning is long overdue. The next problem that I would just want to indicate is that we have a massive ingress from the tobacco industry, and they have brought all these products like Zin, Lift, Drift on, and then not to mention these e-cigarettes and IQOS and everything. So they have flooded Pakistani market. Unfortunately, there is absolutely no policy controlling these products, and these products are just being brought in. The only thing that the government did during the last 2 years budget is first that they increased the tax on the imported tobacco products from 65% to 100% last year. That is during 2021 budget. And this year, they just increased the tax of 5,200 rupees on 1 kilogram of the HTPs, that is heated tobacco products, which are imported from abroad. So that, in a way, is a tacit approval from the government that you can, in Pakistan, you can bring these products in and you can only pay the tax and you can get away with it. The most or the best recommended policy for countries like Pakistan is that simply all these products need to be banned. And we have Dr. Sana is going to, I hope she's going to talk about it, that I think all these products have been banned in India, which is our immediate neighbor, and in many other countries around the globe. So Pakistan needs to follow follow the good examples from around the world and follow the instructions which are there from WHO also, that we need to put an immediate ban on all these products, or at least come up with a policy. So just a few recommendations briefly. The rotation of the graphic health warning is long overdue, and this needs to be done. I'm sure Dr. Samra Mazhar is going to update us on this rotation issue. The next thing is that the regional best practices and the global best practices need to be followed, which are pretty good. Like India has 85% graphic health warning. Nepal, which is a much smaller country, they have almost 90% graphic health warning, and we are still stuck at 60% and aspiring for 85%. Preferably banning policy for the new novel products, which is also recommended by WHO and the unions and Bloomberg and its partners around the globe. So we need to follow that. And graphic health warning on smokeless products also needs to be considered. Again, giving the example of India, they have this warning on smokeless products, but we have not even started talking about it. So briefly, this is what is my take on this issue. Thank you, Wasim. Thank you.
Thank you very much, Mr. Wasim, for summing it up. And I would now request Colonel Azhar Salim to kindly share his thoughts on the aspects I've discussed earlier. Sir, your mic is on mute. If you can kindly unmute it.
Sorry. Thank you very much for inviting me on this webinar on a very important issue. And while I was there as Chief Executive of Human Development Foundation, where I was there in that organization for over 17 years, one of the projects that I at that time participated in was this anti-tobacco campaign. And ever since that time, I have taken keen interest in what is happening. The irony is that whereas we have, I have a long list of laws that were made by Pakistan. There have been 3 laws, 22 SROs, and some about 2 Federal Excise Acts. But some or the other, the implementation has been lacking. Now, as far as this graphic warning is concerned, yes, there was a time, probably we were the first to think about bringing it to the level of 85%. But then I think while it was just being discussed, India had already done it. But we still kept on thinking about it, and then we slowly moved from 40 to 50, and now the current status is that we are at 60%. Then again, that rotation was supposed to be done ideally every year. But I think we had initially, we had a picture of lips with some cancer. And then one time it was shifted to this, where we have this gangrene or cancerous stuff on the foot. Thereafter, nothing has happened. So this is, again, something which is still pending. Yes, we have thought of doing it to the extent of 85%, and we must do it as early as possible. Creeping towards that target is not really enough, because this is one of the very potent tool that has been proven to reduce smoking, along with the prices and other stuff that is taking place. I would just like to also share with you, you've already talked about the smokeless ends, electronic stuff like Joule, Sovereign, My Blue, We Use, Alto, Hello Whip, and now Velo. No laws exist. There have been studies carried out in Pakistan, and I would just like to share with you that in 2011, the study indicated that only about 1.5% of the youth used it. In 2017, it very rapidly grew up to 11% of the youth smoking smokeless stuff. 2018, it went to 21%, and thereafter 2019 and onwards, it has gone beyond 28% of the youth taking this smokeless stuff. We also know that there are many other smokeless things that are in the market. Just to give you, there are about 24 million people that use tobacco stuff in Pakistan, and 15 million are smokers, and 9 million use smokeless products. Now that is a big percentage, and there are no laws to put a stop on that. So I think very rightly brought out, we need to take it very seriously and make some laws, not only graphic warning, but other steps that are very effective, like increasing the price, taxation, and all that needs to be put into force. I just went through the list of the organizations and countries that have really banned e-cigarettes in their countries. There are, to my knowledge, there are about 22 countries, and USA, India, among the Muslim countries, Indonesia, Jordan, Oman, Qatar, have also put a ban on e-cigarettes. I think it's about time Pakistan very seriously gave it a thought and put a ban on electronic delivery systems that are taking. In fact, it is the industry itself that is promoting all these things. So I think for now this much, and then I will listen to other participants and say and add at a later stage. Thank you very much for giving me this opportunity to say a few things.
Thank you very much, Colonel Azhar Salim, for joining us today. Now I would jump across the border because we are having international participants from across Pakistan, Dr. Sahana and Dr. Larissa. I would request Dr. Sahana to please give her presentation if she has. And then we would go to Dr. Larissa. After that, we would request Dr. Minhajul Siraj, and for the closing remarks, we would request Dr. Samra Mazhar. So the floor is yours, Dr. Sahana.
Can you see my screen?
Yes, it's visible.
Thank you very much for inviting me. It's my pleasure. But a very humble submission right in the beginning. I'm a public health dentist and I teach public health dentistry at a dental college. We have postgraduate students and undergraduate students with us. And we carry out research, and of course, field activities are also very much part of public health dentistry. We have a mobile dental clinic, and I have also associated myself with an NGO which is working for in the area of tobacco control. I also work with the district tobacco control cell. But the humble suggestion is that I may not be a perfect person for, talking about graphic health warning in India. Nevertheless, I've made a good attempt. I've put some slides together. So going ahead, as Wasim mentioned, we have banned e-cigarettes, and this was in 2019. Okay, that is called the production, the manufacture, the import, the export, the transport, the sale, distribution, storage, advertisement is all banned in India. Now, coming to the graphic health warning, you can see what we have had over the years. What was the graphic health warning in 2006, in 2009, then in 2013 and 2016. Now we have a new set of warnings, which I will be elaborating on. There have been debates over these graphic health warnings. Will the layperson understand? Will he or she not understand? What is the meaning of this scorpion? Do they understand these are lungs, etc.? There have been a lot of discussions. Now, moving on to the 2018 amendment rules, after which we have had the 2020 amendment rules. So here also, this is the Cigarette and the Other Tobacco Product Act, the amendment rule, the second amendment rule 2018. So this is for the attention of the manufacturers, distributors, retailers, and for the importers. So this came out in the year 2018, and they said there has to be a mandatory display of 85% of the principal display area. And these rules came into force on 1st September 2018. They've had two images which rotate for 1 year each. So this one is from 2018 to 19, and this one is from 2019 to 20. And immediately after that, we have had the third amendment rules 2020. Now going back here, what else is mentioned in the image is there, plus it is written tobacco causes cancer. And this shall appear in white font color on a red background, and the words, the quit line is also given. They felt that it is important to put the quit line there so that the users, be it smokeless tobacco users or the smokers, see the quit line and make a quit attempt by calling the quit line. On image two, this came into effect from September 1 to 2019. The word tobacco causes painful death appears in white font color on a red background, and the similar words, quit today, call this number. Okay. Now the pictorial health warnings, they have to maintain the minimum of the 300 dpi. That is the color, the font, everything has to be mentioned. And all the tobacco product manufactured or imported or packaged on or after the 1st September 2018 have to display this, and this is on rotation. And any person who is engaged directly or indirectly in the production, supply, import, or distribution of cigarettes or any other tobacco products shall ensure that all the tobacco product packages shall have the specified health warning exactly as prescribed, that is 85% of the display area. And the violation of the above mentioned provision is punishable. There can be imprisonment and there can be fine according to the COTPA, that is section 20 of the COTPA. Moving on to the next one, that is the third amendment. It is similar to the earlier one. This third amendment came out in July 2020. You see that the images have changed, and these are the recent images, but otherwise more or less everything else is the same. So I will not talk about in detail, but you notice these images, and they have very clearly mentioned that this is for specified health warning for both the smoking and the smokeless forms of tobacco products. As you all know, the low middle income countries, the main problem here is use of smokeless tobacco, and those belonging to the lower class, not necessarily so, but generally the uneducated, those belonging to the lower class are consuming smokeless forms of tobacco in India. And this image on the smokeless tobacco products hopefully will help them in giving up the habit. And all this needs to appear in local languages. It is English, Hindi, and if you go through the Ministry of Health, and Family Welfare. Under that, the NTCP, the National Tobacco Control Program, they have given this in various languages. So if, since I'm in Maharashtra, a city called Pune, which is close to Mumbai, here the warnings appear in Marathi, so that the people, the local people understand the local language and are in a position to, or are being helped to quit. Now, there are few studies in relation to this. I just gathered few studies in relation to the pictorial health warning. Now, this particular study done in which is published in 2020, and this was, I think, the people from the Johns Hopkins Bloomberg School of Public Health were involved in this. What did they do? They wanted to find out whether the pictorial health warnings are depicted on the smokeless tobacco products. So they collected smokeless tobacco products which are sold in Maharashtra, that is the state where I belong, Uttar Pradesh, Assam, Rajasthan, Karnataka. From 5 states, they collected the products. And what did they find? They found that the warnings were selectively blurred or manipulated in a fashion so as to obscure the health warning label. That is 6% of the times they found out that. And in 10% of the products, the labels that had some combination of heavy tint, faded colors, or brand stretching, and in 53% entirely blurred warning images. This is happening because enforcement or implementation or keeping a watch on people, whether the graphic health warnings are really being printed or no. This kind of enforcement is lacking. It may not be done on a war footing. That is why this is happening. The cigarette packages, most of them had no health warning label manipulation in India. This is the result of their study which they have conducted. So here in the picture, the first picture, you see that the matter is accurately printed. In the second one, mouth cancer is blurred so that the consumers did not see it. And in the third picture, warning is completely blurred. You don't see it at all. Now, this is a drawback. This, is definitely not acceptable, but unfortunately, this is what they're seen in the rural areas in the 5 states of India. Moving on to the next study, this is also published in the year 2020, where they evaluated the role of media in implementation of the 85% graphic health warnings on tobacco products in India. So they wanted to know what is the role played by the media. So the media articles from the date of notification of 85% graphic health warning in India, that is October 15, 2014, to the date of implementation, that is April 1st, 2016, were collected. They collected a total of 3301 media articles regarding the 85% graphic health warnings, and out of which the media articles, from amongst the media articles, those for the graphic health warning, 85% graphic health warning were 2961 media articles, 333 articles were anti or against it, and 7 were neutral. So what did they finally conclude? That there was a positive correlation of media on the implementation of the graphic health warning. Moving to a third study that I came across, this is again published in the year 2020. This was regarding the impact of the health warning on the cigarette packs in India, findings from the Global Adult Tobacco Survey 2016-17. As you all know, 2019 to Global Global Youth Tobacco Survey results are out in India already. So they took these cigarette packets and they found out that 77% current smokers noticed the health warning on cigarette packs and thought about quitting smoking. And on adjusted analysis, when they analyzed the results, when they adjusted the analysis, they found out that buying cigarette packets instead of buying these loose cigarettes, and those who already made a quit attempt in the last 12 months were more likely to think about quitting because they have seen the health warning label on the cigarette packs. Now, the levels of education and the wealth indices associated with the intention to quit due to the health warning labels were definitely there. As we all know, less educated, maybe chances of using these products are there because, they don't have the education. They're not aware of, ill effects on the oral cavity or the distant organ of the body. They are not aware that this is a life-threatening disease, especially among the children. You see them consuming because of peer pressure, just for having fun. Somebody else is having these arecanut products. The friend is influenced. He also consumes it. Okay, and the wealth in the indices were also associated. The better off, the knowledge is better, probably better educated. Maybe this has influenced the understanding of the health warning. So I just collected some local products, and I just was interested, curious in knowing whether they have this 85% health warning label or no. This was collected yesterday. I asked one of my intern to do it for me. He did it for me. So this is what you see. And he told me, madam, most of the packets that I'm checking, all are having the health warning, he said. I said, okay, then stop collecting. Now there was another intern, Shivani, who helped me with this. I told her to collect the smokeless tobacco products locally. So she went one step forward. She not only collected products from her hostel, especially these maushis, the ayas, the workers in the hostel, they consume smokeless tobacco. Plus we see the vendors outside all selling tobacco products. And she hails from Bihar. So she told me, madam, I want you to also display the products from Bihar. So we have products from 2 states of India, that is Bihar and Maharashtra. The first few products are pan masala products. Please be aware that gutka is banned in many states of India. Gutka is a pure version of arecanut, and arecanut is responsible for oral submucous fibrosis. In my college, we get to see cases of oral submucous fibrosis, and when it reaches stage 3 or stage 4, the mouth opening is limited. Ultimately, it leads to cancer. And some of these products, this product is from Bihar. We notice that there is no graphic health warning at all. And some of these products are from Maharashtra. Some of them do have the warning, some of them do not have the warning. I think the study number 1, where I quoted that the rural, parts of India, the packets may have blurred images. I think this is what I get to see here as well. So this is all that I have to add, and thank you so much.
Thank you very much, Dr. Sahana, for sharing the stats. And I must appreciate that Ministry of Health and Family Welfare of the Government of India has done a lot of work on the issue of tobacco warning. And it's one of the best examples in the region besides Nepal. Blurred and fade coloring is one of the major issues besides the absence of pictorial and graphic health warning. Now, I would request Dr. Larissa to kindly share her thoughts, or if she has a presentation, she can also share it. Thank you very much, Dr. Larissa. Your mic is mute.
Yeah, sorry, I just pressed, yeah, okay, desktop. 1 second, sorry, it's always the same with me. Share and so I think you can see my presentation now. Can you see my presentation?
Yes, it's visible, ma'am.
Okay. So I wanted to start my presentation. This is all the picture of the swimming team here. It has both, they're wearing t-shirts of our NGO with the 47, which is the health law that we are promoting, and our logo, which is the Jordan, the Arabic la, which means no, with the cigarette smoke coming out of it. So this is our NGO, the logos, the 47 for the health law and the no to smoking. Just a quick, what is the status quo in Jordan? We are only 11 million people, but we have 80% of our men are smokers and about 20% of our women are smokers, and the numbers are rising. When we analyze the numbers are higher in the younger age group. And exposure to secondhand smoke is really high. About 80% of adults and 60% of children are exposed to secondhand smoke. And when we look at the graphic health warnings, we see that 1 out of 3 current smokers thought about quitting because of warning labels. And when I compared this number with the global numbers, I found that it is quite low. For example, Canada, it was over 70%. So it also made me think about how effective these warnings that we have right now are in Jordan. If we look at the numbers of deaths, we have about 9,000 deaths, which means when I talk to people, I tell them this is 1 death per hour. And the deaths are usually quite young, under the age of 70. And the deaths due to secondhand exposure is 1,600 people annually. Also, the majority of deaths are due to non-communicable diseases, which also is something that makes us think, because we are a fairly young population. The majority of the population is under the age of 30. For all these things, just to put things in perspective on how grave the situation is. Also, the economic burden is really high. We had the investment case study of tobacco, which was published in 2019. Because whenever we talk about anything related to tobacco control, we get the answer, the income. So Jordan gets about 900 million Jordanian dinars from the tobacco industry directly and indirectly, but we spend about 1.6 billion. So the net loss, and this is 1.6 is actually only direct and indirect health costs, whether it's direct by expenditure to treatment of diseases, or indirect costs by premature mortality, or not being able to go to work, or poor efficiency at work. So, so our net loss is about $1 billion annually due to the tobacco burden. And we also noticed that the family spends on average about $100 on tobacco products, bearing in fact that in general, the minimum wage is $300 in Jordan. So it's about 1/3 of the income is spent on tobacco products. And from the Department of Statistics, we know that about 60% of families who get aid from the National Aid Fund, which means these are the poorest of the poor in Jordan, they have 1 smoker in the house. So pictorial health warning. In Jordan, we are working right now on changing the pictorial health warnings and meeting with different government representatives, because I'm part of the committee. We hear, especially from Department of Finance, from the tax, from the trade, and from the at the borders control, they all tell us, no, you will increase illicit trade, because people don't want to have packs of cigarettes with the pictorial health warnings on them, but they do not do them, and they do not affect the international intellectual property law, nor the trade organization law, and which is very important for us. They are really fast and cheap to implement, because at the end, the tobacco industry is the one who has to implement and print and do everything. It is at their cost, and they're the ones who will lose from the decreased sale of their products. The FCTC states that it is associated with 7.7 reduction in the prevalence of smoking. And according to the Jordan investment case, over 15 years, every JD spent in implementing the pictorial health warnings, we will have a return of 324 JDs. So what is the status quo on the pictorial health warnings in Jordan? I went to the shop next door, and this is a small neighborhood shop. It's not a big supermarket. They have 2 big displays like this one. This is one, and there's another one. And this is how the cigarettes are displayed. For pictorial health warnings, in 2004, when Jordan ratified the FCTC, we had the pictorial health warnings were put, and the regulations were amended in 2012. The pictorial health warnings were last changed in 2013 for cigarettes and in 2014 for molasses. I actually remember the pictures that were put on the cigarette packs before the ones that are present now, and they were actually much better and more effective. These are the 4 pictures that we have. I took this picture also from the supermarket. You can see that the quality is really poor. They address 4 things: to address passive smoking around children, so that it causes asthma in children and that you shouldn't smoke around children. They also talk about smoking being an addiction, and that smoking causes a slow and painful death. Generally speaking, I would say, as a non-smoker, these pictures don't talk to me. I mean, I don't find them shocking. As I said, the quality of the pictures are really poor. And this is Marlboro, which is the most expensive brand of cigarettes that we have, and it is really popular among the population. So these are just before COVID, we had a committee meeting in order to have new health warnings on the cigarette packs. We chose 14 images from the ones that are available, global ones. We circulated them amongst a group of specialists from different departments. Actually, they were workers in the government. And we found that because we started with a larger group of pictures, we wanted to select 14 to use them for the study to be implemented on the public as a formative study. So the ones that actually bothered the majority of our participants was the ones related to impotence and infertility. So these were, when we talked about this, this was the uproar. No, these are the ones that you cannot use. And we saw that they were really upset with this fact, especially that many of those people were smokers themselves. So we felt that this is actually the one picture that has to be included in the next set of graphic health warnings, was something related to impotence and infertility, because this is the one that the smokers really felt bad about. But we have also a huge problem with the molasses. These are molasses found in the shops, the mu'assar used for shisha. As you can see, they are really very child-oriented. They look very fancy. Myself, once I went into one of the shops because they were placed just next to the candies I wanted, and they look exactly like the small hard candy packs. So by mistake, I grabbed one thinking it was candy, and then I looked at it and I discovered that it was molasses. So this is the molasses that we have. We have bubblegum, mojito, lemon and mint, blueberry. And the picture and the warning is really ineffective. This is a warning. It says that beware, smoking affects your health and causes death. And with shisha, with just a snake instead of a hose. Honestly speaking, this is very ineffective. And another point is, when we talk about molasses, many people smoke shisha in cafes, and they do not see the packs. So one of the things that we were discussing is the necessity of putting warning labels on the devices themselves. So if you go to a cafe and instead of the fancy shisha that is served, you have a shisha that has a big health warning all around it, saying not just a sentence, but a picture of people with different cancers and how effective this would be. And when asking people, we found it was really effective, that people would not enjoy smoking a shisha in a cafe if the devices had on them health warnings and pictorial health warnings. These are also pictures that I took. We have here nicotine pods for e-cigarettes, and down there's the heats for the IQOS. And as we see again, that the warnings are just general health warning, and in general, our society, they don't read, to be honest, and people really are not affected by any health warning that you see. Pictures speak much louder than any word. So if we have if you look at them, cool mint, water, melon, ice, and that, people even would not notice the lower small print that says that smoking causes cancer and heart disease. So what needs to be done? I took this picture from the EU. In Jordan, they are insisting that we will only follow the EU recommendations. They don't want to go beyond that. So what has been allowed is, and what will be discussed now, because the committee should be meeting again soon, that we only are allowed to increase the pictorial health warning to 65%, that's the maximum. We want it to be a minimum. Of course, also, as we noticed, the placement of the pictorial warnings in Jordan is at the lower end of the packet as opposed to the upper end, which is what is recommended. We do have information on nicotine and tar content, which is also something that is not recommended. And we still use misguided names like slim and other names, words that are not allowed. The pictures, they should be rotating. Right now, our pictures are very old, and as you have seen, they're, I would even assume that the tobacco industry had something to do with putting them because they're that ineffective. And we need to add the quit line number. By now, we have a quit line by the Ministry of Health. The addition of pictorial health warning to water pipe devices. When we go to heated tobacco products and e-cigarettes, because the EU has only these sentence warning, this is only what we are allowed to put on our products here. We discussed during the committee meetings on the necessity of putting these warnings as well on the devices, and this was met with a big no by the industry, and they managed to get what they wanted. And plain packaging is something that we have been discussing, and we have also been confronted with a big no. Thank you all for your attention, and this is a brief analysis of the situation in Jordan. Thank you.
Thank you very much, Dr. Larissa. A very perceptive and insightful presentation. You also shared that the status quo of the pictorial health warning in Jordan. And you said that unfortunately in Jordan, the ban has been lifted and during this COVID time, and both electronic nicotine delivery system, which we call as ENDS, and the heated tobacco products, HTPs, have now been allowed. So this is so unfortunate at the part of the government, probably. We are having Dr. Samra Mazhar because there is some issue with Dr. Minhaj Siraj. He's not connected right now, so we would directly request Dr. Samra Mazhar to give the government's perspective on the tobacco pictorial health warning on the tobacco packs. I would also request other colleagues to send their questions in the question answers box so that we can, at the end of the discussion, we can take the answer from the panelist. Over to you, Dr. Samra, please.
Yes, thank you very much, Mr. Asif, and thank you, SDBI, for arranging this webinar. This was a very informative session. On the government perspective, the first question is the update on the 85% increase court case impending decision in Islamabad High Court. As you all know, the case is in the High Court, and I have an update that this month earlier hearing has been done, but we have not been informed of the outcome or the further decision of the court till now. And the second is the delay in implementation of the rotation in Pakistan, which is overdue by many months. So first of all, let me correct you that Pakistan has up till now has used 3 pictorial health warning. The first was a mouth cancer, the second was a thoracic cancer, throat cancer, and the third was which is presently can be seen on the cigarette packs, is the gangrene of the foot. So the thing has this was implemented in January 2019, and usually we do we have to rotate the pictorial warning or to enhance the size after 2 years. So but due to COVID, the process was delayed. And as you mentioned that in the October 2020, the pictorial health warning was selected. But that was selected by the committee, and but again it was a mouth cancer picture. So later the policymakers did not agree on this, that this has been used as earlier. So we may go for another pictorial health warning. So then again we were fighting with the 3rd and 4th wave of COVID-19. So the process was delayed, but this year in September, Again, the committee has decided a pictorial health warning, and they have selected a picture which is a new one, but it has a copyright from WHO because it has been used by another country. So we have requested WHO to provide us the copyright. So as soon as it is received, we will process for the further procedure of issuing an SRO. So the picture will be rotated. So regarding the other thing, the best practices we have learned from Dr. Sahana, and it was very rightly pointed out that if the pictorial health warning on the smokeless tobacco products are not accurately printed, then they are of no use, because these products are sold in non-standardized packaging with a wide range of shapes, which can make it difficult to identify a primary surface area or a front or back. So this is a problem same in Pakistan, and that the cigarette packs warning are implemented, but the other products, some are like the novel products, they are imported, and this pictorial health warning cannot be used on that. And others which are locally made are also not implemented properly. So what can be the recommendations, the global health warning? I think before the global this graphic health warning, there should be an accurate statement of the quantity of the contents in terms of weight, measure, or numerical count on all these tobacco products, either smokeless or cigarettes. So the contents are also not available. So the warning should appear on all tobacco products, including smokeless and new novel products. The warning should feature mandated description of harmful health effects and specific illnesses caused by any smokeless product. Warning should appear in all principal languages of the country. Like we have Urdu and English as an official language, but I do understand that these smokeless tobacco is used widely in the remote areas. So we can have these warnings on in local languages too. So this is from my side. Thank you very much.
Thank you very much, Dr. Samra, for updating us on the current status of pictorial health warning in Pakistan. I would request if there is any question, you can write it in the chat box. Mr. Wasim, would you like to ask anything at the end, or shall we close the session?
Really, I don't have anything to say. If other honorable members want to say something, they're welcome to do that.
Colonel Salim, probably you have raised your hand.
Yes, I have one question, and in fact, I have one pack of imported cigarettes. There's just a small line in Persian that says that smoking is bad. My only worry is that the imported cigarette or illicit trade that is going on in cigarette industry is to the tune of about 16%. I mean, 16% cigarettes in the market are, illicit trade based. Pakistan has not done anything about it. Whereas in the FCTC, it is written that even in the imported cigarettes, the warning is given, but it is not according to the FCTC, terms. I think there is a provision in the FCTC text that anything that is imported by any country, they are supposed to make sure that it contains warnings in accordance with FCTC. That is not being done. So this is something which the government should take care of. And of course, all that illicit cigarettes that are coming into the country without warning or with very little warning. Firstly, it should be stopped at all. I mean, there shouldn't be any illicit trade of anything in the country. So that is one thing. Then Of course, there are many things in the smokeless category, like pan, naswar, and all those things, which are not in the package form. They are just in open form. So there has to be a law which should say that the open sale should be discouraged, should not be there. They should be in a proper package with warnings. So laws need to be made, one, that they should be packed properly. Naswar is just, being sold, or pan is just being given without any package or packaging. So I think one, that they should be in package. Even this pan, sipari, and whatever little things that we buy in the market, there's no warning on that. So I think the government has to give due attention to this aspect, because 16% of about 9% of the non-smoke items are being sold in the market, and that is a very big percentage. Thank you.
Yes, Dr. Larissa, please.
Yes, I just wanted to comment on what Dr. Salim said. We had the problem with molasses in Jordan. They were being sold unpackaged, and you can buy them by kilo in shops and choose whatever flavors you like. And even we had them being mixed locally in tobacco shops. And this is one thing that the government did. It banned the smoking of loose molasses. So now the customer can only buy small packages of 150 grams of molasses. And for the sale to the restaurants, they can buy 1 kilo packages. But the loose sale has been banned, and they actually following up very strictly on that. It was not only because of the health warning, or actually it was the lesser part, but because that people were mixing different things without any control from the Jordan FDA. So anything could have been mixed inside these mixes. And that's why the government moved and banned the sale of loose molasses. And I think it's similar to the products that you were talking about.
Sir Wasim, and then
yes, just to add on to what other Saab said, sir, we actually conducted a similar kind of activity, a webinar last month, which was on illicit and illegal tobacco products, and we discussed all these issues at length during that. And we understand that your observation is accurate, that we have illegal and illicit tobacco coming in from all sides of Pakistan. We need to take control of that. And your other observation on the smokeless tobacco products, such as Naswar or Snas or whatever is there. Of course, the government needs to formulate a policy. Like I highlighted, there is no policy existing which could a comprehensive multi-sectoral policy which could cover comprehensively cover all the tobacco smoking as well as smokeless tobacco products. Thank you so much.
Thank you very much, Mr. Wasim Janjua. And
thank you.
Colonel Azhar rightly pointed out that there is a need of legislation at the government's end. And now, on behalf of Sustainable Development Policy Institute, I would thank all the participants, and Dr. Sahana from India, Dr. Larissa from Jordan, Dr. Samra Mazhar, who's representing Government of Pakistan, Colonel Azhar Salim, Mr. Wasim Iftikhar Janjua, and all other participants for sparing time for this important discussion. Thanks a lot. I think we must conclude here.
Thank you very much.
Thank you.
Thank you.
Thank you, Asif. Thank you.
Thank you very much for giving us this opportunity to say our bit.
Thank you.